Welcome to the guidance for these movements, which can be done lying down. You can use a mat or blanket if you like. Before you begin, there are a few things to be aware of. You will be guided in some gentle postures and movements. The intention is to bring awareness to the sensations in your body. While it's okay to feel some effort or stretch, it is important not to push beyond your limits and only do what feels comfortable and safe. If you have any injury or mobility issues, then please be careful and only do what's right for you. If you are not sure, then consult with your doctor or physiotherapist. Treating yourself kindly, not competing with yourself or others. Bringing gentle curiosity and awareness. So this is a set of floor exercises that you can do lying down from the same position. So we begin by lying on a flat surface. If you have a mat or a towel or anything to lie on, you can use that. Just find a comfortable space lying on your back. Just feel the floor. To begin with, raising the knees up towards the ceiling and putting your feet flat on the floor, and just finding a position that you're going to be comfortable with there. And just follow the breath for a few moments as you settle. The first of these movements is very subtle, so there's an lot to see, so I'm going to try and describe the movement. It's actually a small rotational rocking movements in the pelvis. So feel the space, your lower back on the floor, and notice how in the small of your back there's a curve. So as you rotate the pelvis to make that curve more prominent, you're lifting that small of your back further off the floor and the space beneath you is increasing. So you tilt the pelvis backwards so that the lower back arch is more pronounced, turning that all the way as far as it will go. And then very slowly returning back, tilting back the other way so that the arch of your back is reducing and reducing until the small of your back actually begins to touch the floor or is closer. When you get to that position, just hold there for a moment and then return back, turning the pelvis again the other way, increasing the arch so that you come to a place where the arch is at its maximum. And then returning back again, tilting the pelvis the other way so that the lower back is touching the floor and the pelvis is tilted as far as it will go. Now let's do these movements just for a little bit longer with the breath. So as you breathe in, turn that movement in one direction. As you breathe out, tilt the pelvis in the opposite direction. And then one more time, breathing in and breathing out. So very small, gentle movements, and you can slow this right down. So just resting there, going into neutral position there for a moment, noticing how the hips and the body feels, noticing the breath. As I said, this movement is a very small, subtle movement, and you can practice that for a while and you begin to get the hang of it. For the next step, we raise the hips off the floor into a sort of half bridge position. So raising the lower back up off the floor, keeping the shoulders nice and relaxed on the floor, the head nice and relaxed on the floor, the arms and feet giving you stability, and raising the body into a plank shape, nice and straight, and raising that up and holding that position if that's okay, just as long as it feels okay for a few moments. Following the breath, keeping the breath soft, flowing, becoming aware of your feet, your arms, and the shoulders and neck resting. So the shoulders and neck are in a nice relaxed position, not tensing. Feel the lower back. And then as you begin to come down, imagine that you can curl your spine back onto the floor, rolling it down like a chain, slowly bringing that back all the way down, resting again on the floor. And if you like, you can, in your own time, repeat this movement a few more times. But for now, we're going to just move on to the next exercise. And the next one is where you bring your knees up towards your chest, both the knees up towards the chest. Grab the knees if you can, wherever is comfortable, and very gently pull them towards the chest. Just not necessarily very tight, nice a gentle tug, pulling that so there's a little bit of tension. Notice the stretch in your lower back and just a sense of stretching around the hips and lower back. And then your gentle rocking movements, perhaps back and forth, very gently massaging the lower back. And feel that stretch, resting into that movement, aware of your breath. And now returning both legs back down to straight position. Bringing one of the knees, either of the knees, back up to where it was before, right the way up towards your chest. Grabbing the knee like that and just pulling it gently towards your chest again. And once you pulled it nice and gently towards your chest, bringing the head up towards the knee, not trying to reach it, it's just a gentle movement. You're not straining the neck. The movement is from the chest and shoulders rather than the neck. Bringing that up and holding that for a moment or two. Remembering to breathe. And then gently releasing the head and the knee to go back down to a flat, straight leg position. So straightening that leg out. And when you're ready, bringing the other leg up towards the chest, all the way up to the chest, then grabbing it by the knee, grasping it gently and pulling, just creating a little bit of tension there in the leg and the pelvis. And getting into the breath, feeling that tension as you breathe. When you're ready, bringing the head up towards the knee. You're not trying to reach it all the way, it's just a gentle movement. Again, the movement is from the shoulders and chest rather than the neck. And holding that. And now gently releasing the knee, releasing the head, bringing everything back down slowly, safely back to the floor and legs straight. And just feeling the feeling of resting and breathing. Aware of the body and the contact with the floor. And the last movement just for this particular set is where you bring your knees back up to the ceiling and the feet back onto the floor, nice and flat, and get that posture balanced for yourself. And when you're ready, allowing the knees to drop down to either side, letting them just drop all the way down, releasing the lower back so that you can get as much of a stretch, a gentle stretch as you can. And the knees may not reach all the way down to the floor, just as far as they will go, with your upper back and shoulders flat on the floor. So there's a diagonal stretch there. And just letting that posture stay for a moment. And coming back to a center position, knees up into the air, and then letting the knees fall down over to the other side. And letting that rest down as far as it will comfortably go. Resting in that posture for a little while. Again, the shoulders and back are flat on the floor. So there's a diagonal stretch. Just observe the breath, making that soft, releasing the breath, letting it flow. And then when you're ready, bring the knees back up to the straight upright position in the middle and resting there for a few moments, just noticing how that feels, following the sensations of your breath, connecting with the floor, connecting with the breath.